Is your newborn baby crying too much? Are you finding it hard to soothe them? We've all been there, the endless nights, the constant worry, and the feeling of helplessness. This video aims to shed light on why newborns may cry excessively, and more importantly, the potential dangers of shaking a baby out of frustration or despair. Because let's face it, we're only human. It's important to understand that excessive crying is a common concern, but can be managed effectively. So, let's dive in and unravel the mystery together. Crying is a baby's way of communicating. It's their language. To understand this language, it's crucial to decode the reasons behind a newborn's excessive crying. One of the most common reasons is hunger. Newborns have tiny tummies and need frequent feedings. If it's been a couple of hours since their last meal, that wail could be a request for more milk. Discomfort is another major reason for those tears. This might be due to a dirty diaper, a burp that needs to get out, or even an uncomfortable clothing tag. Babies can't adjust their environment like we can, so they rely on us to keep them comfortable. Tiredness, too, can lead to excessive crying. It seems counterintuitive. Shouldn't they just fall asleep? But remember, babies are still figuring out how the world works. They don't always recognize their own signs of fatigue and can become overwhelmed, leading to a fussy, crying baby. Then there's overstimulation. The world is a symphony of sights, sounds, and experiences for a newborn. Sometimes it can all get a bit too much. Too much noise, movement, or even cuddling can lead to sensory overload, resulting in a crying baby. Illness or pain is another possible reason. This might be a little harder to decipher. If the crying is persistent, different from their usual cry, or accompanied by other symptoms like fever, vomiting, or a rash, it's a good idea to consult a healthcare professional. Colic falls into a category of its own. Characterized by episodes of crying for more than 3 hours a day, for more than 3 days a week, it can be a major stressor for parents. The exact cause of colic is unknown, but it's believed to be a mix of a baby's sensitive temperament, their developing nervous system, and their still maturing digestion. Lastly, there are times when a baby might cry for no apparent reason. They're fed, clean, well-rested, not overstimulated, and seemingly healthy, but they're still crying. This can be incredibly frustrating for caregivers. In these cases, remember that crying is normal behavior for babies. It's how they express themselves and interact with the world. Even though it can be heart-wrenching to hear your baby cry, keep in mind that you're doing your best. It's okay if you can't always decipher the reason behind their tears. However, it's also important to remember that sometimes babies cry without any apparent reason. So take a deep breath, give yourself a moment, and then return to your baby with a calm, soothing presence. They're just trying to navigate this big new world, and they need you to guide them through it. When a baby cries excessively, it can be frustrating, but it's crucial never to shake a baby. This is a statement of fact that everyone who cares for a baby needs to remember, understand, and act upon. The reasoning is simple, yet critical. Shaking a baby, even briefly, can lead to serious and even fatal consequences. But why is this so? The answer lies in the unique physical characteristics of a baby. A baby's neck muscles are not fully developed and their brain tissue is exceptionally fragile. This makes them vulnerable to a form of child abuse known as shaken baby syndrome, or SBS. Shaken baby syndrome occurs when a baby is forcefully shaken, which can cause bruising, swelling, and bleeding in the brain. The impact of shaken baby syndrome can be devastating, leading to permanent brain damage, learning disabilities, physical disabilities, behavioral disorders, and even death. So, what can you do to avoid shaken baby syndrome? Firstly, recognize the signs of your own frustration and take a break when you're feeling overwhelmed. It's acceptable to put the baby in a safe place and take a few minutes to calm down. Secondly, don't hesitate to ask for help. If you're feeling stressed, reach out to a trusted friend or family member who can provide a brief respite. Lastly, learn and utilize soothing techniques to calm the baby. This could include swaddling, singing, rocking, or simply providing a pacifier. We'll delve into these techniques in the next segment. The injuries from shaken baby syndrome can occur quickly and are not always immediately noticeable. Symptoms may take hours or even days to appear, which can include irritability, changes in behavior, difficulty staying awake, eating, tremors, vomiting, and seizures. It's a chilling reality, but it's important to face it head-on. Knowledge is power, and knowing the dangers of shaking a baby, as well as strategies to prevent it, can save lives. Remember, no matter how frustrated you get, shaking a baby is never the solution. Instead, take a break, ask for help, and use soothing techniques to calm your baby. So, how can you soothe a crying baby without resorting to harmful methods? The first strategy you might want to try is swaddling. Swaddling is a technique that mimics the comforting, cozy feeling of the womb. It helps to keep a baby's arms and legs contained, which can prevent the startle reflex that often wakes babies up. To swaddle a baby, wrap them snugly in a blanket with only their head poking out. Make sure it's not too tight and that they can still move their hips and legs. Another effective method is singing to your baby. You might not believe you have the voice of an angel, but to your baby, your voice is the sweetest sound in the world. Singing a lullaby or even humming a tune can have a calming effect. The sound of your voice can provide a sense of familiarity and security that helps to soothe them. Gently rocking your baby can also be very effective. This method taps into your baby's natural love of movement. You can rock your baby in your arms or use a baby swing or rocker. Just remember to always keep your movements gentle and smooth. You don't need to rock them vigorously. A slow, steady rhythm can be very calming for a baby. Using white noise is another strategy that can help to soothe a crying baby. Babies are used to constant noise in the womb, so the world can seem eerily quiet to them. White noise, such as the sound of a fan, a vacuum cleaner, or a white noise machine, can mimic the womb's ambient sounds and help your baby to relax. You might also want to try the colic carry or gas hold. This is a way of holding your baby that can help to relieve gas and soothe a baby with colic. To do this, lay your baby face down on your forearm with their head at your elbow and their legs straddling your hand. This position can help to release gas and soothe a fussy baby. Another technique is the 5 S's method developed by pediatrician Dr. Harvey Karp. This involves swaddling, side or stomach positioning, shushing, swinging, and sucking. These 5 steps mimic the conditions in the womb and can be very effective in calming a crying baby. Remember, every baby is unique and what works for one might not work for another. It might take some trial and error to find the method that works best for your baby. And that's okay. It's all part of the learning process. It's also important to note that while these techniques can be very helpful, they're not magic. They won't always work immediately, and they won't always work every time. Sometimes a baby just needs to cry. Crying is a baby's way of communicating, and sometimes they just need to let it all out. When you're trying to soothe a crying baby, it's crucial to remain calm and patient. It can be very stressful and frustrating when your baby won't stop crying, but getting upset won't help the situation. Take deep breaths, step away for a few minutes if you need to, and remember that this phase won't last forever. Lastly, don't be afraid to ask for help. If you're feeling overwhelmed, reach out to a trusted friend or family member. They might be able to offer some advice or just give you a much-needed break. With patience and practice, you'll find a technique that works best for your baby. While it's normal for babies to cry, there are times when you should seek professional help. Navigating the waters of parenthood can be a challenging task, especially with a newborn that cries frequently. While it's an integral part of their communication, there are certain signs that should raise a red flag, urging you to seek professional help. If your baby's crying seems unusual or different in some way, it's essential to trust your instincts. If the crying sounds more like a scream or a whimper, or if it's more intense or high-pitched than usual, it's definitely a good idea to consult a professional. Inconsolable crying for several hours can also be a cause for concern. All babies have their fussy moments, but if your little one is crying non-stop for 3 or more hours, and this crying is more frequent than 3 days in a week, it's time to reach out to a healthcare provider. This could be indicative of a condition known as colic, which, while not dangerous, can be very distressing for both the baby and the parents. Physical signs can also indicate a need for professional help. If your baby has a fever, is vomiting, refuses to eat, or has trouble breathing, these are all signs that something might be wrong. Unusual behavior, such as lethargy, irritability, or a change in sleeping or eating patterns, should also be taken seriously. It's always better to err on the side of caution when it comes to the health and well-being of your baby. Don't let fear or uncertainty prevent you from seeking help. Healthcare professionals are there to assist and guide you. They can provide reassurance, advice, and if necessary, medical treatment. Remember, as a parent, you know your baby best. Trust your gut feelings. If something doesn't feel right, it probably isn't. Never hesitate to reach out to a healthcare professional if you're concerned about your baby's crying. Your baby's health and safety should always be your top priority. Understanding why your baby is crying and learning how to soothe them effectively can make a world of difference. Let's take a moment to reflect on what we've discussed today. We started by exploring the reasons behind a newborn's excessive crying. It's important to remember that crying is a baby's primary means of communication. It could be a sign of hunger, tiredness, discomfort, or even just a need for attention. We then delved into the dangers of shaking a baby. It's a sobering reminder that a moment of frustration can lead to tragic consequences. Shaking can cause severe brain damage and even death. If you find yourself losing patience, it's crucial to step away and take a moment to calm down. Next, we talked about various effective ways to soothe a crying baby. From swaddling and shushing to offering a pacifier or a gentle massage, there are numerous techniques to try. It's all about finding what works best for your little one. Finally, we discussed when to seek professional help. If your baby's crying seems excessive or unusual, or if they show signs of illness or distress, it's always a good idea to consult a healthcare professional. Remember, as a parent, you're doing the best you can. It's okay to ask for help when you need it.